The following presentation is brought to you by Methodist Hospital, a Clarian health partner. 100 years ago this month, construction began on Methodist Hospital in Indianapolis, a hospital that would quickly become known for anticipating and responding to the medical needs of the greater Indianapolis community. This year, we began a 3-year Centennial celebration, honoring a history rich in major firsts and in providing patient care second to none. Please join us for this very special presentation.
Throughout the 19th century, a hospital was a place for the sick to get sicker. These pest houses, as they were called in the days, were frightful places indeed. The medicine of the day wasn't much better. Cure-alls hawked in Indianapolis took the form of Kickapoo Indian oil and Dr. Thomas's electric tonic. By 1899, however, bacteriology was an accepted science, and new hospitals were being planned nationwide. In fact, many of America's great hospitals, places of healing and scientific accomplishment, were built in the first decade of the 20th century.
Methodist Hospital was founded by the Methodist Church in July of 1899 at the Epworth Youth League Convention in downtown Indianapolis. The first $8,000 was raised for Methodist Hospital at that convention by youth from all over Indiana, in fact, all over the country.
The word Methodist is not about ownership or control. It's about spirit. It reflects a belief that patients in this hospital are never simply medical cases. They are whole beings of mind, body, and spirit.
Methodist care has its roots in John Wesley's philosophy that the purpose of medicine was to treat the whole person. So therefore, John Wesley preached that you have to treat the mind, body, and spirit, which means that you have to be keenly in tune with all the needs of the patient as the patient moves through the system.
Join us for a story. It's a story of how a century-old mission to treat, heal, teach, and uplift is expressed today. It's a story of how a city's landmark institutions, from places of worship to halls of medicine to a former brickyard, have all been propelled forward because of a hospital.
Speed is king, and scores of thousands are here.
At the Motor Speedway, we've provided health care there for many years, and what has led to really a lot of research and a lot of innovation in the care of race drivers that are injured, but also a lot of research and innovation in trying to prevent injury and illness to drivers at the Speedway as well.
Methodist Hospital sets the standard in kidney stone care due to the work of the Indiana Kidney Stone Institute. Methodist was the first hospital in the United States to offer the non-surgical kidney stone crushing technology called lithotripsy, performed by Dr. James Lingman of the Indiana Kidney Stone Institute. Since then, he has pioneered other treatments for kidney stones, including a minimally invasive percutaneous surgery technique. Through the work of the Indiana Kidney Stone Institute, urologists and researchers at the Indiana University School of Medicine are discovering what causes kidney stones to form and the safest, most effective ways to treat them or prevent them from recurring. For a free brochure on the Indiana Kidney Stone Institute, call Clarian on call at 1-800-265-3220. There are thousands of places we could begin, including here at the beginning of a breakthrough in how a killer disease is brought under control. In the early 1920s, a diagnosis of diabetes was akin to a death sentence. George Clues, head of the research staff of Eli Lilly and Company, attended a lecture by Canadian scientists who were controlling human blood sugar using insulin from the pancreas of animals. To test and manufacture this new medicine, Eli Lilly and Company was willing to commit fully, and so was Methodist Hospital. By August of 1922, the first doses were ready for testing, and with the first injections at Methodist Hospital, diabetes was finally coming under the control of modern medicine. Methodist Hospital's leadership in the treatment of diabetes reaches beyond the history books into the lives of people right here, right now.
It's a complex disease. It takes a lot of time and effort to really get some of the medications at the right doses.
And it draws.
So our job is to try to figure out, is it maybe their meal plan, is it the medication, is it their exercise, is it the stress in their life? You know, what might be causing their blood sugars to fluctuate.
At Methodist Hospital, we've simply come too far to let diabetes get the better of our community. But sometimes we're not combating a disease. Sometimes the enemy is time. And time again, Methodist Hospital succeeds thanks to the Lifeline Emergency Transport. When we come back, the story continues.
The Indiana University Hospital Department of Urology, ranked 15th in the nation by U.S. News and World Report, continues its long tradition of world-class care by leading the way in traditional and minimally invasive surgery. With the largest laparoscopic and robotic surgery programs in the state, Department of Urology physicians are experts in the minimally invasive treatment of a variety of conditions, including the majority of kidney, adrenal, and prostate surgeries. Patients at Indiana University Hospital benefit from a multidisciplinary partnership between the Department of Urology and the IU Cancer Center, Indiana's only cancer center providing patient care designated by the National Cancer Institute. For more information about the IU Department of Urology, please call 317-274-7451.
Fletcher Ernsberger was the first baby born at Methodist Hospital. It was a glorious day that was destined to be repeated again and again and again. Trauma, it happens on the highway, the farm, the job site, or at home. Trauma kills more people under the age of 45 than any disease or illness. It is the patients who receive medical care within the golden hour following the traumatic injury that are most likely to survive.
Speed is probably the biggest virtue that we offer. There's a concept that you're probably familiar with called the golden hour, and the helicopter really helps in that regard.
Everything just springs into motion. It's sort of on autopilot, you know, everybody knows what they need to do.
And the life-saving program, which began in 1979 as Indiana's first airborne medical transport, recently soared over 2 major milestones: 25 years and 25,000 safe flights. As good things happened with Indianapolis's growth, so did the accidents and the need to respond. It was Halloween night. As families watched an ice show at the State Fair Coliseum, a butane gas explosion hurled men, women, and children onto the ice. The hospital's disaster plan brought the 50-member staff of physicians into the ER immediately. 120 people were treated, 74 lost their lives because of the explosion. It was one of Indianapolis's darkest days. Methodist Hospital is prepared for whatever lies ahead for this city. The American College of Surgeons recognizes 4 levels of trauma centers, with Level 1 trauma centers providing the highest level of care. Less than 3 in 10 of all emergency departments in the U.S. have earned the Level 1 distinction. Methodist Hospital is one of only 2 Level 1 trauma centers in the state.
We are the front line of medicine. We're the front line of the medical field down here.
They're clinical experts. They thrive on excitement, and they work well together under pressure. That's what they do. That's why they choose emergency medicine.
The Trauma Center program is comprehensive and includes initial emergency care, intensive care, labs, operating rooms, rehabilitation, and others. What's more, orthopedic and neurological surgeons and critical care specialists are on site 24 hours a day, 7 days a week, and other specialists are available when needed. Next up, we meet a man with a new heart and a new outlook on life, all because of a new way to keep him alive. As Clarian Health continues to set the standard in healthcare, the most important standard is patient safety. Pharmacists within Clarian facilities are key players in delivering the best and safest care to patients. Over 50,000 doses of medications are dispensed to Clarian patients each day, from a simple dose of Tylenol to a very complex dose of chemotherapy. The pharmacist makes sure those doses are there, ready to give, and provided in a safe and efficient manner. Clarian pharmacists round with the physicians and nurses daily, looking at each patient's list of medications, making sure everything is correct. They also look at medications that a patient should be on, but are not. For example, if a patient's blood pressure is too high, or their blood sugar is too high or too low, the pharmacist will recommend the patient start a blood pressure medicine or some sort of diabetes management. Clarian pharmacists are just one of the reasons Clarian is leading the way in patient safety. For more information on patient safety initiatives throughout Clarian Health, visit clarion.org. In 1918, nurses took babies outside for some fresh air and sunshine twice a day, weather permitting. And you see those? They're diapers, washed and left out to dry in the sun to freshen them up.
My name is John Patrick Bilmer. I'm here at Methodist Hospital waiting on the transplant list. I am currently on the Thortec machine, and I'm waiting for a heart to come in. This is my blood actually in here. It's pumping it through my heart, through my body, and then back into here.
That was in November of 2003. What happened before and after was nothing short of incredible. In other words, it was what happens here at Methodist Hospital nearly every day. First, the before.
I know I'm young, I'm 30, and it's unusual for somebody that's at my age to have this problem. It was a virus, is what my doctors are telling me. I couldn't breathe, and I went into the doctor, and they told me I had an enlarged heart.
Pat Bielmir needed a transplant, and while Methodist has top transplant surgeons and staff at the ready, these patients must first be strong enough to undergo the operation. Then, on August 28, 2003, Bielmir coded. The Methodist team brought him back.
That's when they decided to do the Thortec. So at one point I was dead.
He had a cardiac arrest and was resuscitated. And it was after that that we became involved as surgeons to help with the assist device. Pat happened to be the first patient we had with the Thortec system. And I think that we received approval in December, I believe, for outpatient care, and he went home in December. The donor shortage is such a problem that people will actually die waiting for a transplant if they don't have some sort of mechanical support. And these devices have allowed people to be supported until an organ can become available and then be subsequently transplanted.
Bielmir became only the second person in the country upon Thortec receiving FDA approval to leave the hospital with the device in tow.
The machine's like my best friend. It's making me feel better. It actually puts me to sleep because of the ticking noise. It goes with me everywhere, so it's like a piece of luggage you just push around.
In January of 2004, the Thortec had done its job. Pat Bielmir was ready for his new heart when one became available. Now, not only does Bielmir have a new heart, he has a new wife. He and his wife, Joy, also a Methodist transplant patient, met at the hospital. That's 2 new hearts out of more than 500 transplanted here. When we return, you'll meet the very first. Dear Clarion, I would like to thank Methodist Hospital's Labor and Delivery Unit for providing an outstanding birthing experience. Thanks to the talented and caring nurses who provided patient-centered care and made me feel that they truly cared about my baby and me. Since giving birth at your hospital, I tell everyone that Methodist is #1 by far. Thank you. Sincerely, Melissa Zetti. Pediatric rehabilitation is a specialty focused not on major milestones and miraculous recoveries, but on the small steps that add up to big improvements in the quality of a child's life. 8-year-old Rex Harvey's heart was critically damaged in a bicycle accident in September 2002. He was lifeline to Riley Hospital for Children and beat the odds. For decades, Methodist has specialized in the care of children like Rex with special medical needs, developmental delays, and a variety of physical and cognitive disabilities. Now Rex is one step closer to recovery, thanks to the state-of-the-art care he receives at Methodist Pediatric and Adolescent Rehabilitation Program. Indiana's most experienced provider of rehabilitation care. Pediatric and adolescent rehab, part of the Methodist experience. For more information, call 317-962-5302 or visit us at clarion.org. The long association with the Indianapolis Motor Speedway has meant many victories for the city, including the first motorized ambulance that brought injured drivers to the hospital. In 1982, Annie Gardner of Crawfordsville became Indiana's first successful heart transplant recipient and the first ever in a private hospital. 20 years later, we recall the story. No, this wasn't a birthday party. It was more of a re-birthday party. And the special guests have one gift in common, a new heart. They are among over 500 people who have had their lives extended through heart transplants. The party actually started 20 years ago when Methodist Hospital became the first private hospital in the world to perform a heart transplant. Dr. Harold Holbrook was the pioneering surgeon, and Annie Gardner was the first patient. Annie agreed to appear in the program, even though she has suffered a recent injury unrelated to her long-ago surgery.
When I first met Dr. Holbrook, he told me two things: that they had never done transplants at Methodist before, and the only transplant he'd done was on dogs.
All other options had been tried and failed, and she probably had a lifespan of less than 6 months at that time.
When they called and told me that they had found a heart, the feeling was just overwhelming. I did a lot of praying and trusted in the Lord.
It was always comforting for me to know that she had come to peace with her own mortality.
And when I went into surgery, there was this wall of angels around me.
When we had finished sewing in the heart, at first it didn't show signs of wanting to work. And then the moment we gave the medicine that stimulated the heart, it took off and worked wonderfully, and we were all very elated and happy, and I can remember the relief that I felt.
Without the transplant program at Methodist, I would have died.
We had a vision, we had the passion, and we had the persistence to get through the obstacles.
If my family, my friends, need something for a transplant, the way the system is set up here, the experience that we've had over 20 years, in my opinion, there's no place better.
When we return, a boy on a bike and a long and courageous journey back from the edge of death. Dear Clarian, I had surgery at Methodist Hospital and was a patient for nearly a week. My care was outstanding. The staff, the nurses, everyone helped me, no matter what I needed. Johanna worked non-stop solving a problem for me. And Martha was like a sister and a true professional. I've never had such terrific care in my life. Thank you, Kevin Neal Morgan.
Nationwide, nurses are in short supply, so hospitals have to work hard to attract nurses to their facilities. Clarian Health Partners has always taken pride in its nursing staff and the quality care its nurses provide. Recently, Clarian hospitals were recognized with the prestigious Magnet designation for superior nursing care. Only 9 hospital systems have been awarded the Magnet designation in the United States. Patients who are treated at Magnet-designated facilities like Methodist, Indiana University, and Riley hospitals have shorter hospital stays, and their nurses have more time to provide bedside care. Nurses who work at Clarian have a lower patient-to-caregiver ratio, more opportunities to advance their education, and they have access to the latest in medical technology. To learn more about Clarian, visit clarion.org or call 800-265-3220.
Delegates to the 1899 convention of the Methodist Church's Epworth League wore these official badges as they proposed the creation of a new hospital. Their motto, look up, lift up.
He was doing what every 8-year-old boy does on a late summer afternoon, was out playing and riding his bike, and apparently he wrecked on his bicycle. The left atrial appendage had ruptured at its base. That type of injury is almost always lethal.
Just want to put in a couple.
Rex, or Tough as his family calls him, did survive thanks to the right decisions by his doctors in Peru, Indiana, and then at Riley Hospital for Children, where Lifeline first brought him. But the road back for Rex took him through pediatric rehabilitation at Methodist Hospital, and his entire family discovered the meaning of taking life one step at a time.
Dr. Rofeld put it in the odds of Tough living through this accident with 1 in 10,000 kids. Actually asked me if I'd buy a lottery ticket that night, because he said that was kind of luck we were having. So he's come through quite well so far. We've still got probably a year in rehab to go.
One of the tenets, the basic tenets of physical medicine and rehabilitation is the quality of life. And we'd like to look at that not only for the individual patient needs, but also for the needs of each family.
We were here at Methodist on the pediatric floor for 12 weeks. And when we left a couple weeks ago, he could walk with a brace and a cane. And he has learned to eat and talk and do lots of things that he could do before. Going from not being able to do a whole lot, not even sit up in bed or stick his tongue out, I mean, through the therapist's expertise, he has learned how to do all that stuff again, and he just continues to make progress every day.
Okay, raise your hand up. Many families don't know what to expect and how to reset their goals. At the same time, some families don't understand that they can still have goals for these children.
My expectations for him haven't changed any, even now compared to before the accident. He'll still probably go to college. He'll still be a professional someday. That's my hope. He'll still play sports, but not at a competitive level. He'll do all the things that any child that hasn't been in an accident or had a brain injury, he'll do the exact same thing that they will do.
We get back inside the hospital right after this, healing the human brain. It's rounds for Dr. Michael Turner, a pediatric neurosurgeon with the Indianapolis Neurosurgical Group. Visiting with his little patients is a good part of his day, but talking with their families can be painful. Often it falls to Dr. Turner to inform anxious parents that their child has suffered a devastating head injury, all too frequently from a preventable accident. It's called shaken baby syndrome. When adults shake a baby, they forget how fragile a child really is. But Dr. Turner and his fellow neurosurgeons never forget, and that's why they stress prevention and education. Their advice, think first. The Indianapolis Neurosurgical Group, part of the Clarian experience. For more information, please contact the Indianapolis Neurosurgical Group at 317-396-1300. Toll free at 888-225-5464 or on the web at ingmdgroup.com. Hospital food? In 1915, it's fresh and hot from a kitchen on each floor. When Nick Scarpino was 10 years old, he started suffering from migraines. They worsened, and Nick went to Methodist Hospital for an MRI. The news was devastating.
I sat there thinking everything's going to be fine. He is just having migraines that hopefully he will grow out of someday.
Nick Scarpino had what we call an arteriovenous malformation, and for short we call it an AVM. This is a tangle of blood vessels, usually within the brain, sometimes can be in the spinal cord.
There was a problem, and it was a fairly serious problem.
If they have a hemorrhage, they have a 10% chance of dying.
It was difficult for me to even hear what the doctor was saying.
In Nick's case, we felt that the best treatment for him was to use some embolizations to make it smaller and to get some of the deeper blood vessels and then to actually operate on it and take it out.
I truly had 100% confidence in him as a neurosurgeon. I never doubted that he was the right one to perform the surgery.
Methodist houses a 36-bed neuro unit, an 8-bed stroke unit, a 4-bed progressive care unit, and the largest neurocritical care unit in the country.
It's what's in the building and the people that you have in the building and their energies and their devotion to first the care of the patient.
The Scarpino family saw what the expertise at Methodist Hospital meant for them and their son Nick, who is now a healthy, active 13-year-old.
Nick is awesome. Nick is great.
Anne speaks for 97% of patients and families who have been treated at Methodist Hospital. Like her, they say they would come back or recommend the hospital to someone else. You've taken a journey today, a journey through history, a journey from the common to the complex. This is Methodist Hospital. For nearly 100 years, we've been setting the standard for comprehensive, compassionate care, and it continues.
The baby boom generation is a lot more educated than the prior generation about what opportunities there are for good health as we get older. And so I think that we're going to have to make sure that we can provide not only high quality medical care, but we're going to also have to provide it at a service level that people expect as well.
We're all focused on number one, and number one is that patient, every part of that patient, every physician, every person who empties the wastebasket, every person who serves food, every nurse that puts in an IV is committed to the quality of care that that patient receives. That's Methodist Hospital.
The people of Indiana have built some extraordinary places. Each one arises on a foundation of traditions and a vision of a better community. We look back with pride. We look ahead with confidence. This is what great communities do. This is their hospital.
Returning our patients to normal function as quickly and safely as possible. That's the goal of the Human Motion Institute at Clarian Health Partners. This team specializes in bone, muscle, and joint care and gives quality attention to any musculoskeletal problem. The Clarian Human Motion Institute provides comprehensive care, whether it's a shoulder, wrist, or hand injury, hip or knee pain, an arthritis problem, or a sports-related injury. And it has a distinct advantage in that it incorporates a strong focus on patient care and also takes advantage of the scientific research that's going on at the Indiana University School of Medicine. Clarian Health Partners, experts in motion. Would you like to know more about the Clarian Human Motion Institute? Call 317-265-3220 for a brochure or to find a Clarian Human Motion Institute doctor.